Good evening, everyone, or good morning from where you are. Thank you very much for inviting me to this very important webinar addressing very important topic. I would like to thank everybody for sharing their experiences with us. Today, we're talking about our experience in building capacities for surgical care within DAHC. We are DAHC, Dubai Academic Healthcare Corporation. We are the corporate, formerly we were the DHA, which is Dubai Health Authority. So we are going through corporatization and vision and values for DAHC is that together we advance health for humanity. Our mission evolves around how we serve to impact lives and shape the future of health through integration of care, learning, and discovery. We are a collective of healthcare facilities, hospitals, and primary healthcare and specialized healthcare centers. Our services vary from pediatrics to trauma to secondary care and primary care and specialized care. We also have a humanitarian foundation with us within the academic corporation, and we are in partnership with MBRU, Mohammed bin Rashid University, as our academic partner in this academic healthcare system. Our primary value in the AHC is patient first, and respect, excellence, teamwork, integrity, and empathy are very important values within our organization. Most of my colleagues have already introduced what is capacity building and the importance of capacity building. So I'm going to go through this very quickly to skip to the new concept that I'd like to introduce in capacity building and nursing professional development. So nurses are the forefront of our healthcare services and even have a major influence in determining the degree of quality of healthcare services in hospitals. The objectives of nurse training, especially in the operating room, are to improve the performance of organization and enhance patient safety. Continuing professional development is essential to ensure that nurses and midwives maintain their skill levels after entering the workforce and are competent to practice according to national professional standards of nursing care and global best practices. Regulating of nursing and midwifery profession is critical to ensure the quality and safety in clinical service delivery. So I won't bore you with the definition of capacity building. This is a quick reminder of how capacity building in healthcare refers to our actions taken to strengthen the organization's ability to achieve its mission and in an effective manner. So we at DAHC are at the taking the steps of assessing our situation of where we are as a corporate. So we manage the demand. We manage the demand according to, I'm sorry, I cannot see my screen. Can everyone see my screen?
Yes, we do.
Yes, I think, yeah, I think it's okay now. So we are taking the first steps on planning on how we build our capacity within nursing workforce by managing the demand according to our healthcare organization priorities and needs, doing a top-down organizational approach and endorsement, evolving and improving the appropriate staff and resources in our plan, partnering with healthcare organizations, global and local organizations to develop and build our competency, the competency of our staff, updating our policies and procedures, standardizing our processes and practices under a shared governance model, tailoring the plans to meet our needs, and putting together a system to monitor our performance to meet our organizational vision and mission. So we're using the model, a very simple model and steps to build our capacity within nursing professional development, to determine the current capacities and assess the skills of healthcare professionals, establishing our goals within a clear vision for all of the units and departments at the level of administration, determine and the capacity and the capacities and gap strength, decide on strategies to achieving these capacities, to implement them, monitor them, reassess them, and plan for the future based on the results. I would like to share with you today our strategy of the framework of nurses and midwives' core work needs during our assessment, our initial assessment in the Central Nursing Department that is being established within the AHC. My former colleagues have spoken about the importance of emphasizing on critical thinking for OR nursing, the importance of practicing evidence-based and scientific-based practices within OR nursing. The former colleagues also spoke about the importance of resilience and strong management to reduce our turnover rates and to retain our nurses. Also to attract more nurses to perioperative fields, and to encourage them to remain within our organizations. So I'd like to share with you the ABC of nurses and midwives' core work needs that we have before our eyes throughout our organizational assessment for transformation. Autonomy, belonging, and contribution. The emphasizing on the autonomy of nursing is very important in all fields of nursing care, especially for perioperative nursing care. The need to have control over one's work life and to be able to act constantly with one's value. It gives the nurses the authority, the empowerment, and influence. Also, the justice and fairness and work condition and working schedule to help in the retaining the talents and reducing the turnover rates. The feeling of belonging, the need to be connected, to be cared by and cared for by colleagues, and to feel valued, respected, and supported. This emphasizes the value of team working and culture and leadership in nourishing the culture and compassionate leadership to enable high quality continuity professional development and improvement, compassionate care, and staff support. Contribution is one of the very important elements that we consider throughout our organizational assessment. The need to experience effectiveness in work and deliver valued outcomes by assessing our workload, our management and supervision, mentorship, the availability of the educational resources, learning and development resources. So as my first colleague in the webinar have spoken about how corporatization focuses on efficiency, quality, and speed, and the reduction of cost within our end-to-end processes and daily operations. I would like to emphasize on the importance of the concept of anti-fragility and emotional intelligence. Non-healthcare organizations have adopted excellent models of anti-fragility within their professional development models and the corporates to meet these goals, which is increasing efficiency, improving quality, improving speed, and reducing waste. One of these very important corporates is Google, the service that we use every day. I would like to share the story of Chad Ming Tan. He is the professional development manager who have issued the Bible of the importance of anti-fragility and emotional intelligence in work to achieve the desirable outcomes. He also wrote a book. It's called Search Inside Yourself, which is something I highly recommend to read, based on scientific methods and evidence. So what is emotional intelligence and why is it important for us? Emotional intelligence is the ability to monitor one's own and others' feelings and emotions, to discriminate among them, and to use this information to guide one's thinking and actions. So emotional intelligence increases personal well-being, increases leadership ability, increases team performance, improves decision-making, decreases occupational stress, and reduces staff turnover. And these are all outcomes we would like to see and we would like to experience whilst developing our staff everywhere in nursing, especially in the operating theater. So investing in emotional intelligence has 5 components. And just like we in nursing, we led the change from moving from case-based to evidence-based, introducing critical thinking, introducing shared governance models, introducing and leading the change in organization by repurposing workforce, repurposing programs. I think it is also time for us to build our evidence, to build our capacity by using emotional intelligence components throughout our programs, throughout our strategies. So the 5 components of emotional intelligence are social skills, being able to create and maintain healthy relationships, decision-making, which is very, very important in professional development and perioperative nursing, the ability to make responsible choices and accept the outcomes, empathy, which is a very core value of our profession, self-regulation, which is very important for nurses everywhere, especially in the operating theater, to gain the ability to regulate emotions and actions in a variety of environments and circumstances. Also self-awareness, the knowledge of one's own thoughts and feelings and motivations. So I'd like to conclude my presentation with the importance of capacity building. Capacity building is a teamwork, it's a team effort. Efforts should focus on what works at the level of individuals, departments, organizations, and systems. Capacity building in nursing will enable all individuals in the organization to function at their highest potential capacity to achieve excellency in healthcare and in patient care. Building the evidence to support the use of anti-fragility methodologies and nursing professional development, I think is an important step to take to lead the change, to introduce this component within our professional development models and strategies to improve nursing. Thank you very much.